week on Grace's Girls Club, we have Dr. Katie Fritz with us. Dr. Fritz, please tell us the company you work for and your title.
Good morning. I am a neonatologist, which is an intensive care doctor for newborn babies at Huntsville Hospital for Women and Children.
Wow, that is a big title right off the bat. Tell me a little bit about your job and your day-to-day.
Absolutely. So I'm a pediatrician first and did additional training to become a neonatologist. I work almost exclusively in the neonatal ICU and or intensive care unit, and I'll call that the NICU through the rest of the interview. So we take care of babies from the moment that they're born through sometimes the first several months of their life, depending on how small and sick they are. I work with a fantastic multidisciplinary team to take care of the babies. So every day looks a little bit different. We never know what's going to happen when we walk through the door of the NICU each morning. But I'm responsible for the babies in the NICU. Some of them have surgical problems. Some of them have genetic disorders, and others are just born really small or early. And we work together to take care of them, to make our plans for the day and the week, and then to deal with any problems that come up. And when I'm an on-call doctor, I'm responsible around the clock for attending deliveries and admitting babies and taking care of any issues or problems that come up.
Dr. Fritz, in preparing for this interview today, I was thinking your breadth of knowledge and the spectrum of what you must treat in a day today has to be so incredibly vast. Is that true?
There are a lot of different things that I do need to know to take care of these small babies, and a lot of school and training went into becoming a neonatologist. And just the experience of seeing babies day in and day out is constantly adding to that knowledge base as well.
Absolutely. And I do want to touch on that schooling a little bit later on. But for now, of the letters in STEM, science, technology, engineering, and math, which letter or sequence of letters do you think most applies to your job in the NICU?
So science, first and foremost, we're all scientists learning how to take care of these little babies and all the different systems in their bodies. We also use a lot of technology to help us do our job, from different ventilators and monitors to advancements in pharmaceuticals. These are all pieces of technology that help me do what I do every day.
Absolutely. So let's go back to that schooling. What type of schooling do you have? What degree do you have? How educationally did you get to where you are today?
So after high school, I had 15 years of formal education and medical training to get to where I am today. It was a long time. So I started with a Bachelor of Science degree in chemistry with minors in psychology and Spanish. I got that degree from DePaul University in Chicago. I went right from there to the University of Wisconsin School of Medicine and Public Health, and actually did a 5-year program to get my medical degree and my master's in public health. After finishing those, I did my residency in pediatrics and fellowship in neonatology, where you're working supervised as doctors in the hospital. And that was an additional 6 years of training before I was out on my own as a neonatologist.
Wow. Well, let's just pause. Congratulations and good for you. You are
Thank you.
incredibly accomplished. I'm sure, I mean, even hearing you talk about it, it sounded very impressive, but I'm sure to be in it, the amount of work that you had to do, that really is quite the feat.
It was a long path to get here, but I absolutely love what I do, so I couldn't see myself doing anything else.
I'm so happy to hear you say that. And let's talk about some of the soft skills. I am sure that in your field, more than probably even many others, even within medicine, those soft skills and that bedside manner is so key. Is that something you picked up more in school or more on the job?
It's a combination. I had some really fantastic mentors through medical school and into residency and fellowship, and I was able to really emulate some of the skills that I saw them demonstrating in terms of how to interact with families. And it also made a really big difference when I became a mom myself at the end of medical school, going into my residency, and being able to approach my job from primarily a doctor's perspective, but also a parent's perspective and understanding how terrifying it is to have a sick child and trying to help parents through that process, especially in our really long hospitalizations. And I also worked really hard on developing my leadership skills. One of the things I most love about my job is that I am a leader on a big multidisciplinary team where we work together. Sometimes we're rounding in the morning on our patients with up to 10 or 12 people who are all focused in on every detail of the care of each of our babies. And learning those leadership skills was really key in terms of getting to where I am today. And also just the critical thinking skills. There are a lot of things in school that I didn't know how they were going to apply to me, and I might not use those specific pieces of knowledge each and every day, but learning how to work my way through complex problems helps me when I am facing a tricky clinical situation.
Absolutely. Absolutely. Wow, that was incredible. I'm almost picturing, you know how there's the President of the United States and he has kind of his West Wing where he has his chief of staff and his deputy communications directors. I'm almost thinking that's kind of you and your 12 when y'all are rounding in the morning. That's pretty impressive. And
we have
I know
a little neonatology cabinet.
Yeah.
Yep.
So true. I know your patients must feel the care. So I do want to ask you, why did you choose this field? A lot of schooling, a lot of work, but clearly you seem to absolutely love it. So what got you invested and what keeps you here?
So I went into medical school really interested in pediatrics, and I had worked my way through undergrad working with kids, and I knew that that was something I wanted to continue doing. And as I went through residency, I learned that I really loved the inpatient setting and taking care of patients in the hospital. And as soon as I set foot in the NICU, I absolutely loved it. I was fascinated by the transition that babies have to make right at the time that they're born and learning all about the different factors that can affect little premature babies and other sick babies. So I knew once I set foot in the NICU that that was definitely what I wanted to do.
How cool. It's so true. Babies are so strong, right? They have to deal with so many challenges
Yes.
they don't even understand, but they're little rock stars.
They're incredibly resilient. Yes.
Yeah, absolutely. What are some of the challenges that you have to face every day at work and problem solve to resolve?
For sure. We have some really great days in the NICU, and we have some really tough days where we have very, very sick babies and babies who might be too small or too premature to survive. And those are really, really challenging days with our families. So I have worked really hard to learn everything I can about supporting parents when they go through really difficult times. Like I mentioned before, it's also a 24/7, 365 job, and I work with a great team of other doctors where we split up those responsibilities, but there can be some really long nights. There are 2, 3 a.m. emergencies and deliveries that we need to quickly get to. So it's definitely been a long learning curve of how to function at your best in these difficult, stressful situations, sometimes even in the middle of the night.
Absolutely. And I did want to add one more thing. So speaking of that, right, if we have young girls or young students who are interested in this career, tell them what you do to make sure you do perform at your best, both in the physical side of, I'm sure, being sleep deprived and not really having a body clock, but also in the emotional side of, like you said, having good days, but also having bad days.
That is so important, Grace, and it's something that I have learned and honed in on over time. So whatever job we end up in, there are going to be challenges and there will be good days and bad days. And my field is one where there are just very high highs and very low lows combined, like you said, with a little bit of some crazy hours and some sleep deprivation. So I have learned to really rely on my family and my close friends to decompress and to take a little bit of the load off of me when I am going through a rougher stretch at work. For me, I found that exercise is really important, and I get my movement in pretty much every day, even if it's just 15 or 20 minutes. And I found some great places to go in Huntsville, like a yoga studio and things like that, that I can decompress and have a little bit of mindfulness time. And so that, in combination with really good nutrition and staying hydrated, sneaking the naps in when I'm able to, has allowed me to continue to be successful in this kind of tough job at times.
Absolutely. And I'm so glad you said that. You know, I'm not a mother, but a lot of the women I work with here are, and they're constantly talking about wanting to give your best to your career, wanting to give your best to your family,
Yes.
but also having to realize I need just a little bit for myself so I'm able to give that best. So I'm glad you touched on that.
For sure.
So one last question, then I'll let you go. I know how busy you are. If you had a message to young girls or young students in general who wanted to join the STEM workforce, what would your message to them be as they move through their educational career on their way to where we are today?
Absolutely. So there is a place for each of you at the table and in these fields, and you can absolutely do anything you set your mind to. I think that the most helpful thing for me moving through in a time where there certainly were a lot of women going into medicine, but there were still some pretty male-dominated fields, was to have mentors, especially those who could speak to the work-life balance and helping me as I was planning out my own family and trying to understand how I would help my life work between the career side and the family side. So mentorship is so important. Reach out to women who do what you're interested in doing and see if you can come shadow, if you can sit down and have a meal with them, hear about their day-to-day, and hopefully get some firsthand experience into what those careers are. So if you do the legwork up front, you absolutely can find the right career for you and do anything that you set your mind to.
So true, so true. That's terrific advice. Well, Dr. Katie Fritz, thank you so much for your time today. Thank you for your expertise. This was wonderful. I know so many young women are really going to benefit from this.
Thank you so much.
Have a great day today.
You too.